So we have a guest on our show today. She owns a business, the name of Jolt, just down the street, which we're super excited about. Dr. Katz and I happened upon this business a few weeks ago and got excited. It offers PEMF, which Danielle will talk all about what PEMF is, what her business, what conditions it will help with, and it's also in relation to the circulation that we've been talking about here the first half of this show. So without further ado, Danielle, tell us about yourself.
Thank you. Thank you guys so much for having me here. I'm excited to share in what you're doing and so many great things that we're doing for the community. Jolt provides pulsed electromagnetic field therapy. So PEMF has been around for decades. It's an all-natural, non-invasive way to stimulate the body for increased circulation, less inflammation, better blood flow through all the cells in the body. We have a very spa-like environment, so our clients come in, they relax on what looks like a massage table. Our sessions are about an hour long. The frequency naturally starts to rebalance the body, so it's very relaxing, it feels good. And during that time, the energy is actually moving through every single organ, tissues, bones, ligaments, all the way into the mitochondria to start increasing that circulation and blood flow throughout the body.
So a typical question we get asked a lot is, how many sessions on average would it take to feel better, and how many sessions typically is a plan?
Absolutely.
And frequency?
Yeah, really depends on what condition we're working with and how long somebody has had that condition. In general, PEMF works pretty quickly to start moving the body into a better direction of healing. So it is very common for clients to start feeling a shift in their symptoms within 1 or 2 sessions. And then
Great.
during that time, we do offer a new client introductory. We do 3 sessions. And during those 3 sessions, we're really able to see how long the condition's been there, learn a little bit more about the client. All of our sessions are customized, and so we can really give a better treatment plan after we see how well they are taking the energy and how they're feeling.
And do you do it over the whole body every time, or do you space it in sections?
Yeah, every session's different, so depends on the individual and what they have going on. PEMF targets inflammation and problems. So we always stimulate on a whole body approach so that it can pick up on the areas you may not even know need the additional frequency and energy to heal. And then we use different accessories to also target smaller areas, isolated areas. If we need to give more cardiovascular assistance, we have swelling in the lower extremities, numbness in the hands or the feet. We will work the pathways to get more blood flow into those areas. We also use compression therapy at the same time, so we're getting more blood flow, red light therapy.
Excellent.
Yeah, it was a really nice feeling walking into your facility. It was very relaxing. The colors were low. It looked like you could just lay down there and enjoy yourself. It was really nice.
I've walked into a lot of crappy places before. I did not get that feeling in your place.
I would hope not. No, we do it right there, and a lot of people do. They'll wear headphones and actually do some meditation or just relax. It's a nice way to just take a break in the day.
And does everybody have to do an hour?
No, we do 30-minute sessions as well. So the new client intro is 60 minutes. It really does work better. It's a cumulative therapy that builds on the previous sessions. So in the beginning, we do try to give the body as much energy as we can because it's going to heal faster and they're going to get faster results.
And with frequency, is it once a week, every other week? How does that work?
The initial 3 sessions, we always recommend that they get them in within the first week.
Okay.
So PEMF is completely natural, non-invasive, no harmful EMF. It's all good for the body, so it's really safe to do every day. It's very similar to exercise, getting that circulation from our natural exercise. It's also helping move out the negative EMFs that we're exposed to all the time. So that first 3 sessions, we recommend they get them in within the first week. It gives them the best chance to really see how the body feels. And then from there, depending on what the condition is, we have athletes, we have people with high blood pressure, diabetes, sore knees, aches and pains. You know, depends on what they're looking for. So it could be once or twice a week in the beginning. If we have a stroke client or somebody who's really needing a lot of support, we're going to recommend you come in as often as you can. And really thinking of it more like an internal physical therapy program for a little bit, restructuring the mitochondria and the actual healing processes of the body.
Perfect. And since, I mean, we hear it all the time too when we're doing like IV therapies, when we're doing therapies, sometimes 2 or 3 times a week is very difficult for someone to do.
Yep.
If they were only able to do 1 a week, and even in the beginning, would that hinder their results or just be a little slower?
It's going to be much slower. If we can make a little bit more of the investment in time in the beginning, we can slow down in a couple weeks. But the first few sessions really are so important, even if we're getting 30-minute sessions in. So I really would rather see somebody for a couple 30-minute sessions than I would once every week or every other week in the beginning.
We say the same thing with patients all the time too, so that's actually the perfect answer.
Yeah.
I mean, we tell patients all the time, like, it's an investment in your health.
Yep.
And if you're going to do it right. Otherwise, there's no point in starting.
Exactly. It's going to save you time and money in the long run.
Big time, big time.
I'm taking a look at your website right now. It has, it's Jolt, PEMFlab.com, and I see a bunch of chronic disease and conditions on here that PEMF supports. And what we're talking about today is circulation. There's a lot on here that's associated with this, neuropathy, erectile dysfunction, bladder incontinence, chronic pain. Dr. Katz, you mentioned autoimmune disease earlier. I mean, there's so many listed here that, what do you see the most of coming in through your doors?
We see a lot of neuropathy and a lot of autoimmune gut imbalances that lead to other, bigger issues.
It's very cool therapy. Very excited to have you here.
Thank you so much for having me.
Yeah, I guess the best thing to do is tell us where you're located and how to contact you.
Yeah, we're right off the 101 in Shea in the Pima Crossing Center near PGA Superstore. You can reach us at 480-805-JOLT, and we do offer the 3 60-minute sessions for $150.
Yeah, we're gonna go check it out.
I can't wait to have you guys. It's an awesome experience.
We're gonna have to calm down when we walk in there, not with our crazy energy.
We'll get you calmed down.
Okay,
We'll get
good.
you relaxed.
Sweet.
Yeah.
If you feel like you're just not getting to the bottom of your health issues with your current doctor, it's time to call Naturopathic Physicians Group. Our office is located in Scottsdale, Arizona. You can also contact us at 480-451-6161 or find us on the web at naturopathicgroup.com. In our next segment, we will be continuing our discussion on addressing circulation using natural treatments.